Hi, I'm Dr. Steve Pearlstein, and this is Second Opinion. Today we're going to talk about injuries caused by exercise. Hopefully you're somebody who is exercising, and hopefully you have not been injured. But let's talk about the type of injuries that are caused by exercise, and I'll bet you know what they are. Because even though there's more complex injuries than these, the most common are sprains and strains. You know, there's a common misconception that sprains and strains are overly simplified injuries that don't really require much attention. Not true. First of all, sprains and strains are totally different types of injuries because they involve totally different types of tissues. So let's define them. Well, the word strain, S-T-R-A-I-N, refers to an injury to a muscle. And the word sprain, S-P-R-A-I-N, refers to an injury to a ligament. Two different types of tissue. Muscles are soft and pliable. They heal fairly well. Ligaments are tough and fibrous, and they do not heal as well. They require more rehabilitation. So totally different types of injuries. Now, even though they're totally different types of injuries and totally different types of materials, the nice thing is that they respond the same to the first line of treatment. And the first line of treatment is ice. Now, I get this question in my office a lot, and my patients are confused. They're not sure. Tell me, Dr. Pearlstein, am I supposed to use heat first or ice first? Well, I had an example once where somebody had to be carried into my office because they sprained their ankle overnight, and what they did is they slept on a heating pad with that ankle, and they came in fully swollen and in extreme pain. It was a far worse injury and far worse consequences than when they first injured themselves. So they learned the hard way that you use ice, and you use ice for the first 72 hours. That's 3 days. Ice, ice, ice. Then you use heat. You can use ice at any time. It's not like if you use ice 5 days later, it's not going to be effective. But the treatment of choice 5 days later is heat. The treatment of choice is not heat in a brand new injury for the first 3 days. The way you use ice is you can use it for 10, 15, 20 minutes at a time, then take it off for that period of time, then go back to it. And you can do this for a few hours, then you can give yourself a break and then go back to it. So you're going to use ice intermittently for a number of hours and just keep that going. Very, very important. The reason is it reduces inflammation. And in fact, that's the whole point to the initial treatment of a sprain or a strain injury. So you know, you don't have to know whether it's a sprain or a strain injury. It's pretty obvious if you have overdone some movement and you have pain. That's a sprain or a strain injury, and the treatment's the same. So that makes life easy. Now, here's something that you've probably all seen or all heard of, and this is what I'm talking about: RICE. R-I-C-E. So what does that stand for? Well, the R stands for rest. And by the way, RICE is a first aid treatment. It's not a cure. And the whole point to RICE is to reduce inflammation. So that's what rest does. The R equals rest. You need to rest. You need to give yourself a break from the activity. If you are inclined to think that it was nothing and that you're just going to keep on playing, well, you know, in the heat of battle, you may be able to do just fine, but you will be sorry later on. So rest is very important. You've got to pull yourself away from the action, whatever it is, a sport or an exercise program and routine. Stop. You've been injured. Because what one doesn't realize is that there's complications if you don't do this. And so you may think, well, I've got to keep exercising. It's really important. Well, if you do that, you may kill exercise for yourself for quite some time by doing it. So I highly recommend that you pull yourself away from the action and get rest. I stands for ice, of course, and we've gone into all the details about ice that you need to know. And C stands for compression. Compression means that you want to apply pressure to the wound. you want to reduce inflammation that way, and one of the most common ways of doing that is like with a compression sleeve, especially one that's been made of a surgical elastic. That's a tough material. You don't want to cut off your circulation and you don't want to hinder movement, but you definitely want to put some compressive pressure around the wound, like a compression sleeve on an ankle or a wrist, and that helps reduce inflammation. And the last letter E stands for elevation. And perfect example is an ankle. You want to lie down, you want to put ice on it, and you want to raise it up. You want to elevate it above the horizontal, because what that does is it allows venous blood to go back to the heart, reducing inflammation. So RICE, not a cure, it's a first aid treatment, but exceptionally important. Another component, of course, is NSAIDs. NSAIDs are anti-inflammatory drugs, and there's prescription and non-prescription. And the most common non-prescription NSAID is ibuprofen. So you can take ibuprofen. You don't want to take ibuprofen in place of rice. You don't want to say, well, this is going to, bring the inflammation down. Why do I have to do all the other stuff? Yes, you have to do everything to reduce inflammation. And the most important part actually is the RICE. The ibuprofen you can take, just depends on if you like to do that, and if the pain is fairly intense. It can assist the process, but it's not critical. If you have a really severe sprain, then of course you need medical intervention, and let them decide what medications you need and how to deal with it. Some sprains, ankle sprains, require a boot for immobility. So those are complex sprains. We're talking simple sprain, simple to moderate sprain or strain. And again, they're important because they have consequences that you may not be really aware of. So I hope in this video you've learned something new about sprains and strains and how to treat them. I hope now RICE is in your vocabulary and you know what each letter is. I don't know where you're watching this. This video is on my Facebook page, my YouTube channel, it's on my website. Wherever you're watching it, I would love to get your feedback, and I'd love for you to like the Facebook page and subscribe to the YouTube channel. That way you'll get all the videos as they come out. I've already done many. There's many more to come, and I'd also love to hear, is there one that you would like to learn more about, some topic that you'd like to learn more about? Because I'd be happy to talk about it with you. So, again, I hope that this video has been thoroughly informative and educational and fun to watch. I'm Dr. Steve Pearlstein, and this is Second Opinion.